This is how surgeons remove a cancerous or damaged portion of the liver using advanced robotic-assisted liver resection. The liver is one of the body's most important organs, performing a wide range of metabolic and filtering functions. It helps process substances in the blood before that blood returns to the heart and circulates throughout the body. The liver also produces bile, a digestive fluid that helps break down and absorb fats. When cancer develops in the liver or spreads there from another part of the body, surgery may be recommended to remove the affected tissue. This procedure is called a liver resection or hepatectomy. Before the surgery begins, the patient is placed under general anesthesia. The procedure is then performed using an advanced robotic-assisted surgical system, which allows the surgeon to operate through several small incisions with enhanced precision and control. During the operation, the surgeon carefully identifies the tumor and removes the affected portion of the liver. The amount of tissue removed depends on the cancer and its location. It may range from a small wedge of liver to several segments, an entire lobe, or, in more extensive cases, an even larger portion. One remarkable feature of the liver is its ability to regenerate. After a portion is removed, the remaining healthy liver tissue can grow and restore much of the organ's volume over time.